Lymphedema is a chronic condition that affects millions of people around the world. It requires consistent and ongoing management and treatment to avoid the condition's progression and to minimize symptoms and side effects. Each person will need to work closely with a healthcare provider and a certified lymphedema therapist, or CLT, to develop a long-term treatment plan that is individualized for them. But how does one get to see a lymphedema therapist? My name is Kelly. I am a physical therapist specializing in oncology rehab and lymphedema. And in this video, I'm going to explain the process on how to get lymphedema therapy. But before we begin, make sure to subscribe down below for weekly new videos. You can also join us on Instagram for more related content, and you can check out our website for more resources. When someone has any signs or symptoms of lymphedema, such as swelling in the arms or the legs, starting with a primary care doctor or consulting with a specialized healthcare provider is the first step to take. It's important to note that the diagnosis of lymphedema may not be straightforward because there are many different conditions that can cause swelling or other symptoms similar to lymphedema. The doctor will typically review a patient's medical history, perform a physical examination, and do further imaging tests to help diagnose lymphedema and rule out other conditions. When a doctor reviews a patient's medical history, they look for other conditions that may place someone at risk for lymphedema, such as cancer with surgery or radiation, or genetic disorders. To help rule out other causes of signs and symptoms someone may have, the doctor will also look for other organ diagnoses like kidneys or heart failure. In a physical exam, the doctors will examine the areas that are swollen, look for skin changes, and assess for other tissue changes. And lastly, the doctor may order imaging tests, such as a lymphoscintigraphy scan, which can show the flow of the lymphatic fluid through the lymphatics and localize any areas where there may be a dysfunction or function issues that would assist in diagnosing someone with lymphedema. The doctor may send a referral to a CLT for further evaluation and treatment if an individual is diagnosed with lymphedema then. Someone does not always need to wait until swelling is present to see a CLT. If an individual is at risk for developing lymphedema, then seeing a CLT would also be beneficial to learn about prevention and early intervention techniques. Some examples of who is at risk would be after one undergoes lymph node removal surgery for cancer or has injury with significant trauma to an area. The local doctor may know or work closely with a therapist in the area to find a certified lymphedema therapist for you. If not, various training schools list their certified therapists on their website, and organizations such as the Lymphology Association of North America, or LANA, is the highest level certification program in the US. It provides the ability to search your area and state for highly qualified therapists. Other training schools to explore include Close Training, Norton School of Lymphatic Therapy, the Academy of Lymphatic Studies, and International Lymphedema and Wound Training Institute. Once a CLT is found in your area, the next step is to contact the therapist's office or clinic to schedule an evaluation and initial appointment. In the US, it's essential to check with the insurance provider before to understand if this therapist is in your network for coverage and the patient's financial responsibility, like a copay or deductible. Once this is completed and the appointment is scheduled, the next comes the first session. At the initial evaluation and appointment, the therapist will perform a comprehensive assessment, including a skin and tissue assessment, and measure the limb or the area of the affected body. The tool a therapist uses to measure may vary place to place. Most commonly, one may use a tape measure and take circumferential measurements at multiple locations around the limb or the area. They may also use a water displacement or a bioelectrical machine for volume measurements. For areas of the body that may be more difficult to measure, such as the breast or the pelvic region, the therapist may include other assessment tools to obtain a baseline, just to know where the swelling and volume is starting from. To assess for skin and tissue health, the therapist is going to feel for any thickening or hardening and look for any skin breakdown or wounds, and just overall health of the tissue and what it's like. This may help stage the level or the severity of lymphedema and also guide the decision on which type of compression and treatment one needs. Based on the evaluation and the assessment, the therapist will then work with the patient to develop a treatment plan, which will start when someone can be scheduled consistently. It is likely to include CDT with phase 1 and phase 2 treatment. So phase 1 treatment is the reduction phase. This first phase of CDT is going to range from 2 to 5 sessions of therapy a week and averages 3 to 5 weeks or so in duration. This phase aims to reduce the volume and decrease the swelling while softening any thickened tissue called fibrosis. This phase is going to include or likely include some of the following. So manual lymphatic drainage, which is a massage-like technique that encourages lymphatic fluid to flow out of a congested area, as well as techniques to soften tissue fibrosis. Compression bandaging is using short stretch compression bandages and various foams and paddings to help reduce swelling and soften any of that thickened or hardened tissue. Exercises are given that are specific to lymphedema and encourage activation of the muscles, which assist in pumping the lymphatic fluid in the body. If able, it will be prescribed to complete these exercises while someone is wearing their compression bandages. Skincare and education on ways to help prevent infection and maintain strong skin integrity to avoid skin breakdown or wounds is also included at this time. So lymphedema may increase the risk of infection, and the quickest way to obtain an infection is an opening in the skin, making this really an essential piece of the lymphedema therapy. The CDT or treatment will be different for each person and really should be tailored to each individual's medical needs. Additional types of treatment may be included to assist, again, in the goal of reducing the volume of the limb or the area with swelling. The therapist will continue to monitor and reassess the swelling and tissues with that physical examination and measurements, again, taken about every 1 to 2 weeks. Once the volume and the size and the measurements reduce and reach a plateau, then it's time to transition to phase 2 of CDT. The second phase of CDT is the maintenance phase. This phase starts at the end of phase 1 and continues long term. The goal of this phase is to maintain the reduced volumes obtained in phase 1 with now a focus on self-management. This phase may include the following. Self-manual lymphatic drainage is taught by the therapist using the same gentle massage technique to stimulate the lymph nodes and move the lymph fluid through lymphatic vessels. This is encouraged to be done daily. I do have a printout on my website for someone that they can follow along with step by step on how to do this, which I will link in the description box down below. Another component is compression garments. So although bandaging is an option for managing lymphedema long term, it could be better due to being bulky and making it difficult to move around and function to instead use a compression garment or a stocking. So compression garments or stockings, there are different kinds on the market with various fabrics and levels of compression. An experienced therapist will be able to help recommend a proper style and kind, but each person responds differently and may need to try multiple garments before finding one that works best for them. Exercise is also important, so the patient will be encouraged to continue with the exercises that were taught in phase 1 and will also want to continue to find different kinds of activities that are enjoyable to them and that they can be consistent with over time. So routine exercises are essential not only for lymphedema, but really for overall health as well. Another component of phase 2 is skincare. So self-skin checks should be done daily or multiple times a week to look for scratches, cuts, or openings along with any other skin or new tissue changes. If any are found, it's crucial to seek medical attention right away. Pneumatic compression pumps are also a component of phase 2. So if long-term management needs to be very consistent due to the nature of lymphedema, then a therapist may assist a patient in obtaining a pneumatic compression device or pump. So pneumatic compression pumps are medical devices with wearable sleeves that have chambers inside, and these chambers fill with air to create a comfortable compression and fill and empty in a sequential sequence similar to MLD. The pumps are often worn for about an hour a day to help take the place of MLD and work to reduce any increase in fluid or swelling. Airos Medical has a great pneumatic compression device line for both upper extremity and lower extremity, including the trunk. And to learn more about Airos compression pumps and how to get a device, you can see the link in the description box down below. A second phase of CDT will also vary for each person and will change and evolve based on changes in one's condition. So during this phase, one will likely need to follow up periodically with their therapist to continue to monitor and assess for any changes. If needed for a flare-up or progressions, a patient may return to phase 1 as a form of a tune-up, I like to call it, to assist in reducing any increased swelling, softening any tissue before moving back into phase 2. The process of seeing a lymphedema therapist may be simple or complex depending on access in the local area, transportation, and other burdens like finances. The patient can expect to go through a series of steps, including being diagnosed, finding a CLT, and going through an exam and assessment, and then finally being treated. But generally, the goal of lymphedema treatment remains the same. I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.